The video you're about to watch contains graphic images that could be disturbing to some viewers. Viewer discretion is advised. This video is for educational purposes only. Vaginal candidiasis is also known as vaginal thrush or vaginal yeast infection. It is a very common condition in women. 3 out of every woman will have vaginal candidiasis during their lifetime. It is normally caused by yeast fungus Candida. Candida is found in small amounts in the vagina, alongside good bacteria. Normally, Candida and the good bacteria coexist in a healthy balance. Disruption of this balance will lead to an increase in Candida population. Vaginal candidiasis is not a sexually transmitted disease. Many women have vaginal candidiasis for no apparent reason. Factors that may trigger vaginal candidiasis include antibiotic use, estrogen-containing contraceptive pills, pregnancy, obesity, uncontrolled diabetes, weak immune system. Vaginal yeast infection is easily caused by Candida albicans. Candida albicans live naturally in the vagina together with bacteria. Under certain circumstances, this balance can get disrupted. The fungus can start to grow excessively and an infection occurs. A few examples are repeatedly rinsing or washing the vagina with soap, hormonal fluctuations, use of antibiotics, tension and stress. If Candida causes infection, it can manifest in the vagina as well as on the labia. Symptoms of vaginal candidiasis are itching in and around the vagina, a burning pain in and around the vagina, pain during urination or intercourse, plenty of white and flaky vaginal discharge, redness and swelling of the vaginal wall and labia. A vaginal yeast infection sometimes doesn't produce any symptoms, so treatment is not required in such cases. In many cases, your general practitioner can make the diagnosis based on your complaints and external features. If complaints point toward a vaginal yeast infection, your general practitioner can perform an internal examination. A little bit of vaginal discharge is then removed from the vagina for further investigation. Candida albicans can be identified under a microscope. The vaginal yeast infection can be treated well and easily with medication. Vaginal candidiasis can be treated with medicines that kill fungi. Your doctor can select local treatment or a cream for internal use. Also, your general practitioner can prescribe oral treatment such as an oral pill. It is advisable to avoid sexual intercourse until the complaints have vanished. Your partner only needs to be treated if he also has complaints. Dr.Senyo will give you more information about candidiasis and the possible treatments.
Candida. Okay, so hi, Doc.
Hi.
How are you?
I'm good.
Good to see you.
Yes,
all right, Candida. Patrice has been so excited about this topic. He's been waiting for this day. Okay, but so one interesting thing there is that Candida is supposed to be there, cohabitating with
other bacteria,
happily. Chilling together, best friends, like BFFs.
Yes.
Okay, so when it develops into what is this? What some people call white or yeast infection?
Yeast infection. Yeah,
okay,
white.
Yeast infection. How common is that? How common? Do you see
It's
people
really common. If you had 10 women with varied gynecological complaints, as much as 5 out of that 10, yes, would have some form of vaginitis, and about another half of that will be due to Candida infection.
Okay.
You know, God in His wisdom makes everything in a balance, like the ecosystem. You know, certain things will produce, others will eat, they will give off their waste, other people will find nourishment in it. We breathe air in, take some out, other people take it, and keeps everything in a good balance. And it's only when there is interference in that balance, like we see even in the environment, that things begin to go wrong. It's the same with candidiasis. Like you said, we have good bacteria in the vagina. We have Candida. We know that Candida is a fungus, you know, or yeast. And we've said that it's similar to what grows on bread mold, you know. So it also stays there, and they keep the internal environment of the vagina very good and protect, you know, the body from invasion by other known disease-causing agents. All right, so that balance is there. The same balance happens in our mouth, in our gastrointestinal tract, on our skin as well. So Candida is everywhere of the body.
In
now, but today
correct proportion.
in correct proportions. But today we're talking about vagina.
Okay.
When certain situations allow for the Candida to be more than its neighbors, then it begins to grow.
Okay.
Or something happens that reduces the population of its neighbors. Or conditions are right for Candida to enjoy better. When there's inequity in that system, then Candida begins to flourish. I just want us to touch on a few things. We in the video we talked about washing the vagina.
Yes.
Because the vagina has a good ecosystem which is balanced by itself. We don't want anything to go in there except that which has been ordained by God. Or by that, you know.
Yes.
Right. So those stuff will be well taken care of. Any waste or any bad things that are produced or deposited in the vagina that shouldn't be there, the vagina is so arranged that all of its surfaces are directed downwards. And then there's muscle layer, you know, around it. So it forms like a tube. Once in a while, the vagina contracts, and then every bad thing gets, you know, milked down gradually to appear. It appears on the outside for you to wipe out. So you do not really have to wash inside your vagina.
Okay, please say that again.
You don't have to wash.
Please say that
don't
again.
have to really wash inside your vagina.
Okay.
Not even with water.
Not even with water. It cleans itself. If you want to use anything at all, then probably you could use very dry, non-flaking, strong fabric that can easily dab in there and take something out. Finish. Doesn't leave a residue.
Okay.
That at least is better than using water or any fluid.
Or soap.
Or soap, for that matter. Because once you do that, you are able to wash out the other bacteria. They are not so well adapted to the area. They don't have mechanisms that will make them like latch onto the skin there, the surfaces there. So they get easily washed out by water and soap and the rest. And then Candida, you know, I think probably it's been there longer than most of these guys. So it has systems that makes it like hold onto the skin. Even when it is in a dormant state that is not active, it's like more adhered to the surfaces. So just mere washing with soap and the rest will not bring it out.
Okay.
Even when it comes out, it's able to stain the surrounding skin and hang on to the hairs. And then hang on to the underwears that you wear. And then once the conditions are right, they're back inside there. So these are the things that will make Candida, you know, worrisome. All right. Now, why don't we even want Candida to flourish at all? Because once it starts to flourish, it begins to break its bounds. It doesn't stay only on the surface anymore. First of all, it like proliferates in like big numbers, and then you see this whitish cottage cheese like thing being produced. That alone, the sight of it alone is not so good. When it stays in there and heat affects it and other bacteria feed on its byproducts, then you have another infection superimposed on the Candida. Then you see that the color begins to change to yellowish, brownish, greenish, and then begins to give an offensive smell.
Okay.
And when that comes out, is, you know, is not good for the beholder. It makes intercourse very, you know, uncomfortable as well. Then once it's breaking its bounds, it begins to cause, you know, a bit of irritation. The skin structure in there breaks down. When it comes out and gets onto the surface of the normal skin as well, it irritates the skin, one, by the mechanisms that it uses to attach to the skin, and also by the byproducts that it produces. So you see that there's a lot of irritation and itching. It can destroy the hairs, you know, on the outside as well. So you see that the hair starts to break. It eats into the first few layers of the skin, and then you see it give it like a silverish gray, look. And then it looks somewhat like when you've kept your hands or your feet in water for a long time.
Okay.
You see the way it
okay,
appears.
yeah.
Then the skin begins to look like
Okay,
that.
okay.
When other bacteria also get onto such skin that has been destroyed by Candida, then you have a full-blown skin sepsis. So one thing that started with a normal, natural balance that you tampered with begins to go along these ways till you have full-blown disease.
Okay.
It doesn't only end there. When Candida starts all of these things and the infection begins to climb up the womb and get into your tubes, then it could lead to tuber blockage and then also lead to infertility.
So it's important to grab this thing.
You
Candida
need to understand it. You
Before
really
it
need to understand it.
Okay.
Now, there are certain other situations by which your body's immune system will drop. Mind you, what keeps everything in check and balance is the immune system. The immune system says that the skin cells should be aligned this way, certain things should be produced so that when Candida grows to this level, they shut it down a bit. When it's too low, it allows it to grow a little bit. Now, when your immune system drops, Candida knows no control anymore. Then it also grows abnormally.
So if you're pregnant,
If you're pregnant, naturally your immune system has to come down because it has to accept the formation of the baby. Now, if you have HIV/AIDS or you are on chemotherapy, you know chemotherapy is killing your immune system as well as whatever is invading your body as well. Or you've had organ transplant. You know, when you've had organ transplant, we give you medications that will suppress your immune system so much so that, you know, it accepts the new organ, that it doesn't reject it. Now, whilst that is going on, which is a good thing, other stuff also take advantage, like Candida. And then also people who have diabetes. Because diabetes works along so many levels, I'll just touch one. One is the increase in sugar, so it means that in the vagina as well, there'll be more sugar.
like, hey.
And Candida and the rest will grow there. Then two, in diabetes, what we call recruitment of immune cells is also affected. You see, when there is an injury, or let's just say in our state, when there is any trouble somewhere, you will need an alarm system, an emergency response system, call NADMO, call soldiers, call the police. They will have to have a good route to be able to get to where there's the havoc.
Right.
In diabetes, that recruitment of immune cells is affected. The speed with which these cells travel from where they are to get to the site will also be affected. And then the work they do at the site of problems is also affected. So in diabetes, you have double trouble.
all right.
You have high sugar, which the Candida needs to grow and cause trouble. And then also the immune cells that have to help you to fight it as well are lacking or not working.
Okay.
So then these are the situations that come to
So you've
play.
mentioned sugar.
Yes.
So does that mean if you consume a lot of sugar, even if you're not diabetic,
Indeed,
it could...
if you consume a lot of simple sugars, which we find in processed foods,
Right.
I don't want to mention them, the sodas and all of that,
Right, okay.
and the cakes, you know, all these
and
pastries,
chocolates.
yes, and chocolates and the rest. Now, these sugars will eventually find their way into your body fluids,
Right.
of which the vaginal fluid is also one. And it forms good food. I will touch over the conditions that Candida needs to grow again.
Okay.
First of all, it needs to be available there. Two, it needs to have water, which is moisture. The vagina is always moist for a good reason, all right? And then they also need heat.
Okay.
The vagina is within the body and naturally is 4 degrees Celsius higher than normal skin. All right. So that area is already good
That's so weird.
for Candida
You know,
to
last
grow.
week we said the men's area has to always be cooler.
Yes, and then it's 4 degrees
And now the
lower. Yes.
And now the women's area.
It's a bit warm. It
a bit
tells
warmer.
you, yes.
So
That's
what
why
they
there's
meet,
so many.
it goes back to 0. See? Mathematics. -4 plus 4.
I'm having such a good laugh.
Okay.
Right.
This one.
No, it needs to be warm.
He just explained it.
Yes, no problem.
And that's just logical reasoning,
yes.
you
It
know?
needs to be warm for so many other reasons.
Cool,
Yes,
warm.
yes. And you know that we always talk about getting a warm welcome, as opposed to getting a cold
one.
Yes. So
When you're cold, you need something warm to warm
yes,
you
to
up.
warm you up. Yes. So you guys are so beautifully and wonderfully created to always give us a warm welcome.
Thank you, Doc.
But unfortunately, that warm welcome is also good for Candida. You understand? So now it has the heat.
The heat,
It has the moisture.
Okay.
Then you add all the sugars that you eat, and then it's good food.
Perfect conditions.
Sometimes you also add more water by going to wash in there.
Okay.
So the conditions are more than good. Other times you add soap and the rest, so you wash out the other bacteria, so there's no more competition.
There is some feminine soap that women use. Is it advisable?
You see, there's a lot of controversy around these things. Some of the good and useful bacteria in the vagina, like lactic acid forming bacteria, like lactobacilli, are known to fight off other infections in the vagina. So some people have preparations that contain these things, or a well-balanced preparation that can keep the internal environment of vagina good.
Okay.
But trust me, what has the human done so far to mimic nature that has worked so perfectly? I tell people that you have a natural system that can work.
Right.
Why don't you just maintain it?
Okay. So
When you
what should
Actually,
women use?
one, I don't advise any of these products. I mean,
Okay.
I'm so sorry.
Okay. No,
There are times
that's
that
an opinion.
people have certain conditions. They come in and you see that they have what we call chronic candidiasis, very resistant ones.
Yeah.
You treat them. There's something we even call vaginal painting, where we like paint inside the vagina for some time, or even give them medications to take for some time until everything is gone and you are back to practicing good old what we're going to say here.
Okay.
Now those people, sometimes I will give them these medications, but because of business, most of the people who produce these things want to make it a normal daily use thing.
Okay.
And unfortunately, I am opposed to that.
Okay. Because there's
that's
so many of them on the
yes,
market.
a lot
so
of them.
Some of them start with fem, some of them start with lact,
feminine,
some of them.
lact, all of that. Yeah, they'll
Okay.
have
So
good
those
points.
things are not-
They'll
are
have
not
good points to
necessary.
promote them. I'm saying that personally.
Yeah.
Okay.
I tell people that keep your good old natural system. It works. When there's something wrong with it, we can prescribe. Just like in the case of mouthwashes, when we discussed dentistry.
Yes.
We said that it's a good thing, but there are some that are not for daily use.
Okay.
It's
Okay.
period.
Once in a
So
while.
again, for the women, soap is a no.
Water, no. Inserting fingers deep into the vagina. You see, you can wash the outside,
All right.
where naturally the good system has brought all the waste.
Yeah.
And you
Yes.
can see. So pat the lips and wash.
Okay, you can wash that part with
yes,
soap.
the lips. That the exterior of the vagina is super
Soap
fine.
and water,
The
or some of the-
interior, no soap. You can just wash with water. Just to
Oh,
go
the
away.
exterior.
Yeah, but when you're bathing and you scrub with soap, you're washing the hairs and the rest. But when you pat the lips, then you see a different, type of skin.
Yes.
So there you wash with just water, all right? Just water. And you wash from up down. Don't go back and forth,
You look so
forth.
distressed
All right.
by this
Then
information.
don't
Patrice,
also
why?
access-
Have you been washing with
I am not.
What's going on here? I mean, do you see his expression?
I know. When I said pat lips, then it changed.
Doc, I want to ask two questions
Sure.
with this Candida infection. And this has to do with the sexual relationship that exists between men and women.
Yes.
So, for example, if a man has unprotected sex with a woman who has Candida, what happens to the man? And
Right.
for the men who use their tongue on women, what
could
happens
happen
to them?
Right, it's a super good question. When you have intercourse with a woman, unprotected, or even sometimes protected sex, I'll come to that. When the penis goes in there, back-to-back friction in and out, can gather anything that is there.
Right.
So sometimes you realize that when your woman has an infection or a discharge, when you exteriorize your organ, you might see some of the discharge all around. And we are saying that Candida has adaptive mechanisms, so it can catch on, anchor onto the skin. So sometimes some men will get an immediate, infection of their skin, which will lead to irritation, burning sensation, and itching. But for men, because this organ is all out there, we wash. Sometimes you might be able to wash some off. Once in a while, Candida could get into the delicate skin of the interior or the pipe, and then could eat into it and cause infection that could linger on. So when we treat women for Candida infection, we sometimes will treat their male partners as well, so that they don't share the infection back and forth. Indeed, you can share Candida infection sexually, but because of nomenclature, we don't say that Candida is a
It's an
sexually
STD, okay.
transmitted disease,
okay.
but it's transmissible. You can do that.
can do it.
It can
Oh.
happen. All right. Now, when
second
you
part.
you have oral sex as well, mind you, the interior of the mouth is lined by about cells that behave the same way as the interior of the vagina. All right. So Candida can also, get into those places and cause trouble. Actually, when you have Candida in the mouth, that's what we call oral thrush. All right. It happens a lot in babies and it's normal, and in very old people because it's normal because of the changes in the immune system. When it happens a lot in immunocompetent adults, then we could think that diabetes could be underlying it. HIV/AIDS could be underlying it. Some form of hormonal treatment could be underlying it. So definitely this can happen. Now let's come to even protected sex. When you don a condom, it's able to get to a certain part of the penis and leaves a whole area around the crotch. The root of the penis usually will not be covered, especially when you apply the wrong techniques. So you see that the condom gets into the vagina as well as some part of the skin.
Okay.
When you are not in the habit of clipping your skin, your hairs very short, then you also have very long curly hair with crevices and areas in there that harbors some of these secretions and keeps them in there, and then could make you easily give back the infection to your partner.
Oh, wow.
So it's good to keep
Except
it
for people
hair-free.
who culturally, yes. So hair-free is good.
Hair-free is good.
Down there. I mean, if you want to keep hair, keep it here.
Doc, Naneke wants to talk to you. Good morning, Naneke.
Hello, good morning.
Hi.
Thanks for calling, Nana.
I'm calling from assignment.
Okay. Oh dear.
Ashaiman.
Sorry.
Naneke,
Okay, so let's just
yeah.
talk about, because she said Ashaiman, I can only remember the market area of Ashaiman.
Okay.
Now, women who do not like washing down, I mean, I know a lot of women do that, pregnant women especially, also stand the risk of getting a lot of Candida. Yes. And women who don't like changing their underwears frequently, as well as women who do not treat their underwears well, could have infection that will linger on. For example, if you have a Candida infection, you don't use panty liners, which will just trap the infection, or any other infection for that matter, trap the discharge. Then what happens is that the discharge gets onto your underwear, and then we said that Candida, when it forms spores, the spores are resistant.
Yes.
And then they could remain there. Good old washing with soap and water alone will not kill them. Now, what can kill them is when you soak your underwears in well-prepared diluted bleach.
Okay, bleach.
And soak them
Diluted.
diluted bleach, mostly 1 in 10. So it means that if you take the top, you add about 9 more parts of water to it.
Okay, sorry, Chris is on the line. Let's talk to Chris and come back to this.
Right.
Good morning, Chris.
Hello, good morning, Dr. Senyo.
Good morning.
Please, I would like to ask a question. A day before yesterday, I feel some white in my private part. Then I remember my mother told me one day that if I feel something like that, I should use warm water with this local salt. Then this morning I did it, and I can't feel it again. And I want to ask, maybe is it good or should I stop it?
Okay.
Well, what you've just done is a home remedy. Some people use it. But what it heals is really, really the irritation.
Okay.
Whenever you have an irritation, itching, or pain, and you apply something else that gives a different type of sensation, that sensation is picked up by your nerve endings and then sort of makes you forget the other pain. So basically, you have just replaced that warm feeling.
Okay.
Or you've just
The
replaced
cold
the
feeling,
itching with a warm feeling, and then that's it. So you realize that for you, by close of day or tomorrow, God forbid though, you might have the itching again. So you need to be doing that back and forth. Some people do that to the point where they even harm the normal skin. So what you're doing is just for symptomatic relief.
Wow.
You need to get to the bottom of it, and by that I mean go and see a doctor.
Please see doctor. Okay, I've seen some adverts advertising some oral kind of remedy for Candida, and I won't say where I saw it, but and it's a very kind of populous kind of thing.
Well,
you
you
know,
see,
encouraging women to take it for.
I have a problem with those preparations, especially knowing the system that we run in this country. And my good friends at FDA just have to do a good job. They're doing such a wonderful job. But I think that in certain areas we need to push up more.
People need
when
to
someone comes to you saying that I have this preparation that has these properties, let's make sure that we make the research better. You know, and then we also do post-market research. Let's look at the problems that people are getting with using these products, because I see half of the problems. Now you license a cream for skin irritations, and then people are marketing them to be put on cotton wool and inserted into the vagina.
Josephine is on the line.
All right.
Hello, Josephine.
Hello, good morning.
Good morning.
Dr. Senyo.
Hello.
Yeah, hello, good morning.
Yes.
Morning.
Yeah. My question is, sometimes I normally see the chart, not in my part, but anytime I have sex with my guy, and he removes the penis, could see like the cell, is it my orgasm or it's Candida?
Okay.
It's
Well,
white.
it'll be difficult to tell. Sometimes it could just be that you produce excessive fluids, or maybe a lot, not excessive. Or also when your husband ejaculates, and then you continue having intercourse, the semen gets, you know, everywhere, and then you get some on there. If you suspect that you have Candida, it's true that half of the people who have Candida infection will have no symptoms, and then the rest of them would have, like we said, itching, irritation, burning, skin changes.
Can she smell to know whether it is
Candida? Unfortunately, unless it has secondary bacterial infection, will not even smell.
Okay, Candida is kankwe.
Yeah, it's kankwe, it's kankwe.
Strong. Okay,
When-
so she can just go and get checked out if she's worried.
Yes.
Yeah.
Go and see Dr.
So for
Senyo
somebody
if you're
like
worried.
that, after having the sexual intercourse, how does she wash herself?
After having sexual intercourse, your body washes everything, brings it all the way out. So you could put a small pad or panty liner there, and then it just takes everything. You need to just wash the exterior, you know, nicely, and put something there to receive what comes out. The vagina is such, if it was, how do you call it, a waste management company, it will win all the awards.
Okay.
So you don't have to use water,
I
go
think
to
you
the
have to
bathroom
emphasize
and
this about how simple it is to maintain that area.
And you know,
So many things are marketed at us though for cleaning, keeping that area fresh.
Don't
and
buy all
cleaning
those kind of
sprays
things, the
and-
femme fresh and all those things that
it's
people
good
say.
money.
Sorry,
It's good. It's
that's
good
what I know.
money.
Sorry.
It's
But
good money.
don't buy them, don't use them. But sometimes if you don't mention them, people will not know.
Yeah.
Because
And
that's what I
also-
know.
Feminine hygiene products.
Yeah.
There are
Feminine- okay,
sprays,
fine.
there are creams, there are
Look,
gels,
all
there are
kinds of
lotions.
stuff. And it's good money. I tell people all the time, it's good. When people bring me these things to market for them, I tell them, look, this has been my stance for ages. Actually, I had one of my bosses back in 37 who used to have the same stance, and we were totally against this thing. Until one day, he started helping to import one of them. And then he started giving it at his place. So I called him, and I said, hey, boss, why did you change
It's
your
a very
stance?
delicate place,
It's
and
a
if you're not
very
careful
sensitive
enough, you
area.
cause more infections for yourself, and it makes it uncomfortable for yourself and your partner. And if your partner finds you uncomfortable, you go in for another person who is more comfortable with. So please, as Doc is advising, it's a self-cleansing procedure. Do not go and buy anything. Don't walk into any pharmacy or call a friend who says that this can clean, it can wipe, it can disinfect, it can't do any
Just
of those
gentle
things.
cleansing of the exterior.
Exterior. That's
Gentle
it.
cleansing of the exterior. Okay, but treatment though, what do people normally take for treating it?
Usually, people will come into hospital and tell you that you know, they are getting irritation. Actually, this morning I had a call from somebody who said that she was going gaga in her house. You know, just because of itching. She went for a function and just couldn't stay. So mostly when you go for a function, you see women who are a bit.
Doc.
You know,
Is that mostly? You said mostly.
Mostly, yeah.
Mostly.
You know, some of them have issues down there. Now, when you come to hospital, it's likely that we'll give you medication to apply that is soothing, one, and two, also kills off some of the fungi. Then two, we could give you something to insert into the vagina. Most of it is topical. Like we said, these things are playing on the surface. So topical treatment, we put it in there, vaginal pessaries and all of that. They are antifungal. They'll work for some time. when we give you these medications, it's likely that after 24-hour use, the irritation and everything will come down. But please complete the course.
Complete it.
It's very important.
It's very
if you don't
important,
complete the course, you're actually training these organisms to become resistant to low doses until later they are resistant to higher doses.
Thank you so
And
much.
we could also give you medication to swallow.
Okay.
And then give your partner as well. Sometimes if your husband also complains about itching around his penis and his crotch, then we could give both of you creams to apply around the same area. When you are done using these creams inside the vagina, and mind you, this is where I would also give you some of these washes. All right.
Okay.
After the treatment,
It's
it's
easy.
okay. Anybody who tells you that you need more of these things
For
to
regular
keep the
upkeep.
environment okay,
Regular
you know,
It is called Amali.
Okay,
Thank
so
you so much,
keep
Doc,
the
for
lawn
the
nicely
wonderful
tended
education.
and watered
Yeah,
and
this education is very
fresh
key
and
for
lush.
don't
a lot
water
of
the
our
lawn
women.
too much.
don't water the lawn too much.
Well, let me take this opportunity